Well, good afternoon, and thank you all for joining us. I'm Beth Stewart, and on behalf of the Texas Oral Health Coalition, welcome you to today's presentation. As most of you know, people with intellectual and developmental disabilities are living longer than ever before. But with this wonderful progress comes the realization of new barriers for adults with IDD. Today's presentation will describe the healthcare access challenges of aging Texans with IDD, detail the goals of a grant from the Texas Council for Developmental Disabilities, and invite participants to contribute to a solution. I'm pleased to introduce you now to our presenters, Dr. Cameron Jeter and Dr. June Sadowsky. Cameron Jeter, PhD, is a cognitive neuroscientist with expertise in clinical and translational research of oral health and neurological diseases. Dr. Jeter is professor at Kansas College of Osteopathic Medicine. She is a member of the American Academy of Developmental Medicine and Dentistry, speaking and advocating for adults with intellectual and developmental disabilities in annual meetings, webinars, and local chapters. June Sadowsky, DDS MPH, is one of few dentists nationwide to have completed a fellowship in geriatric dentistry. She is professor at UT Health Houston School of Dentistry and leads curriculum and research in geriatrics. Dr. Sadowsky was dental director at Richmond Living Center in Texas for individuals with intellectual and developmental disabilities. She is a founding member of the Houston Geriatric Education Center funded by HRSA and is a member of the executive committee of the UT Health Consortium on Aging. So without further ado, please welcome Dr. Cameron Jeter and Dr. June Sadowsky.
Thank you, Beth. Thank you for the invitation to join all of you at this noon hour. We are eager to share with you the fortune that we have received a grant from the Texas Council of Developmental Disabilities. First, telling you why that matters, we think, so much to adults with IDD in Texas. And we'll end the hour by asking for your contribution, your help, and your ideas. So let me first share with you officially those learning objectives. First is Dr. Sadowsky will describe some of the healthcare access challenges that's encountered by many Texans who are aging with IDD, and kind of even remind us that aging within intellectual and developmental disabilities doesn't refer to someone who's 70 years of age. It could be someone who's 40 or 45 years of age due to their advanced aging from their diagnosis. Second, we'll describe components of our grant, meaning what are we doing as part of our commitment to our funder. And then finally, as I promised, let you know ways that you can come on board and help us. So I'll turn it over to Dr. Sadowsky so she can tell us what is the problem that we're hoping to solve.
Well, number one, adults with IDD in Texas are extremely limited access to informed health care, whereas children with IDD have a small but growing interdisciplinary healthcare network in Texas. Virtually no health providers have expertise in the fields of aging and IDD. Family members and caregivers struggle to find any health care, let alone quality interdisciplinary health care for their aging loved ones with IDD. Unfortunately, even organizations providing supports to adults with IDD and their caregivers do not have access to disability-informed health care. Number two, the parents of IDD are aging and have difficulty ensuring quality care for themselves. Many older adults are cared for by their parents who are aging as well. The parents are overtasked trying to navigate the two difficult healthcare landscapes of adult IDD and aging. Number three is there's a dearth of trained medical and dental professionals in Texas who can diagnose and manage the healthcare needs of people with IDD. Adults with IDD have a unique health component as they age. Texas needs a pipeline of healthcare trainees and providers who are well informed, are well versed in the healthcare needs of adults with IDD. For example, accurate differential diagnoses for adults with Down syndrome and demonstrating a decline that may be due to dementia, it's lacking. And in the age over 40 doesn't necessitate dementia in patients with Down syndrome. So it might be Down syndrome, it might not. There are too few health services and support systems available for aging adults with IDD. Older adults and their caregivers need access to support services, yet many people in Texas do not receive home and community-based services. Some individuals who are on a wait list for many, many years. This lack of support services contributes as a negative determinant for healthy aging. Direct support staff and clinicians need education on the best practices and helping to locate services and supports for these families. The AAPD has a transition where they feel like that they may not have the knowledge to care for individuals with IDD past their pediatric dentist training. So that transition leads to less and less health care. The healthcare fields of aging and IDD are in silos. Services that exist for aging populations, such as nursing homes, are unfamiliar and sometimes unwilling to care for the needs of aging adults with IDD. The healthcare fields of aging and IDD need HIPAA compliant communication, and they need interdisciplinary teams. Back to you, Cameron.
Thank you, Dr. Sadowsky. So what we've laid out is at least 5 difficulties for adults with IDD getting the healthcare they need, whether that's in dental or medical fields. But I'm proud to share with you the progress that has been made nationally through dental policy change. So we're going to be walking through a timeline that began in 2018 that we think gives us prime time now to be making changes in the state of Texas for better oral health care for adults with intellectual and developmental disabilities. So it was in 2018 that the National Council for Disability, here abbreviated NCD, became aware that the ethics statement for the American Dental Association actually excluded the category of disabilities in their statement of who they would not discriminate against. This letter, authored from leaders of the National Council of Disability to the leaders of the ADA, asked that ADA to please consider a change in verbiage to their code of ethics. So in addition to not discriminating on the basis of typical categories like race, sex, religious organization, and affiliation, that they would add the term disabilities. And we're thankful that the very next year, the ADA did such, adding disabilities as a category to which dentists and dental providers cannot discriminate. At the same time, the Commission on Dental Accreditation, known as CODA, also changed their standards. This is the body nationally that tells dental schools what standards they must meet to have a competent graduate from their school. And of course, Dr. Sadowsky and I are from the School of Dentistry in Houston, so this was at a focus of our attention. And it's standard 225 that changed from saying simply that dental school graduates needed to assess the oral health needs of individuals with intellectual and developmental disabilities to the addition of also needing to care for and manage their oral health long term. And that's a big, heavy weight and change to the curriculum at various schools across the nation, meaning that they need to make sure that they have a critical mass of patients with IDD so that the entire student class body has experience in treating and working with patients with IDD. So now that national organizations like the ADA and CODA are saying this is an important issue to us, 2 years later, in 2021, the ADA continued to make further resolutions and changes within their organization. Specifically, their House of Delegates, here abbreviated the HOD, H-O-D, the House of Delegates put forward at least 4 different resolutions to the effect stating that private practitioner dentists, dental hygienists, and the like needed to seek out continuing education opportunities such that they are prepared to not only not discriminate against groups with IDD, but also give informed, evidence-based care to these groups. And understandably, if you didn't learn that in school or there aren't classes currently available for continuing education, the ADA was interested in creating such courses. That directive was given down by the Council for Dental Education and Licensure, which is one of the councils within the ADA. So that's the second orange box there, the CDEL. The Council on Dental Education and Licensure set out some stipulations for what they would like as curriculum for not only current dental trainees at dental schools across the country, but also how are we going to help those dental trainees have residencies or fellowship training available for them upon graduation, and most critically for the thousands of private practitioner oral health providers in the country to get adequate and informed education as well. So this initiative from CDEL was passed on and delegated to the Special Care Dentistry Association just last year in 2022. The Special Care Dentistry Association, if you're familiar with their organization, is divided into thirds. One category, which is serving the special care needs of those with disabilities. This is led by President David Frey, who actually is faculty and our colleague in Houston at the School of Dentistry. And so we're proud to have him on our grant team and working not only at the state level, but nationally, as he and his national team not only create curricula, but figure out how to roll it out, and even possibly in the future have a certification program that dentists who have completed such a training program can show this not only to their colleagues, but their future patients with IDD. So it's with this background that we're going to move on to tell you, so what do the grants that our team have received from the Texas Council on Developmental Disabilities contribute to this national landscape? That's the second learning objective that we're going to tell you about 2 different grants. First, letting you know that Dr. David Frey, president of that disability division in Special Care Dentistry Association, is the principal investigator or the leader of that grant named in the blue rectangle, Collaborative Dental Care for Persons with IDD. And it's with this funding from the Texas Council for Developmental Disabilities that he is working with other dental educators at multiple other dental schools in Texas so that Texas can be the model for the nation that Special Care Dentistry Association rolls out for not only other schools across the U.S., but private practitioners. So namely, he and his team are creating curricula, even a digital textbook. And it's not just online learning, but even potentially 1 or 2 week in-person immersion training at one of the participating dental schools, so that once a practitioner receives their certification, that means they not only have the mental knowledge, but the practical knowledge of working with individuals with developmental disability. That actually is a grant that was awarded just in 2022 and is in its infancy. And so June and I want to spend the rest of our time today telling you about the grant named in the orange box, because it's this one that Dr. Sadowsky leads as principal investigator, and she leads our team now in our 2nd year. This is interdisciplinary care and health homes for aging adults with IDD. The concept that an aging individual with IDD doesn't just need oral health care or just need a cardiology appointment, but needs conference among these healthcare providers and even the help to find them and identify them in the first place. So this slide actually shares the 3 overarching goals of this grant we've received to help aging Texans with IDD. We first will educate those across Texas that are our stakeholders. Second, we will listen to their needs and try to then provide resources in that third goal to connect ourselves to each other and support the work we do, maybe even taking what might work in Austin and replicating it in San Antonio and passing it on to Midland and Odessa so that we can learn from each other. These bullet points I'm going to talk about in further detail on the next few slides. So here we are at that first goal again, which is to educate caregivers in Texas so that they know not only how to interact with adults with intellectual and developmental disabilities, but to be on the alert for any mental or behavioral or functional changes in their loved one or their client that might be the harbinger of the onset of dementia. And this is of import because individuals with intellectual and developmental disabilities, specifically those with Down syndrome, are at a higher genetic risk to have dementia. And not only are they more likely to get dementia, they're more likely to get it at a relatively young age, like in their 40s or 50s. So we, as the grantee, have partnered with the NTG. You can see its abbreviation there in the upper right, the National Task Group on Intellectual Disabilities and Dementia Practices. They are the country's experts on how we identify the signs of dementia and determine whether this truly is a diagnosis of dementia or perhaps another treatable condition that's mimicking dementia. This 2-day workshop that they offer across the state of Texas goes on to teach attendees that we need to remember that although the physician may give a diagnosis of dementia to our loved one or client, we need to consider, was that diagnosis given due to diagnostic overshadowing? And this is the concept that perhaps the diagnosis of dementia was given simply because the patient already has Down syndrome and the doctor knows of the propensity for dementia in this population and almost as a knee-jerk reaction gives the diagnosis of dementia. That can be caustic to the long-term health care of that individual if it's not an accurate diagnosis. For with that comes perhaps unnecessary medications and the stigma of someone having dementia. They go on to help us decipher behavior, letting us know that the potential aggression or resistance that someone with IDD might express in a given environment or scenario isn't purposeful to annoy the caregiver or make life harder for them. Rather, all behavior is communication. And so how do we decipher this communication? One method they offer is the EDSD, which is this very simple rating scale that can be administered by any layperson, a family member, or the direct support professional. And this early detection screen for dementia helps the loved one or caregiver across time track if there's been any changes in their client. And these changes would be those changes in symptoms that might suggest the onset of dementia. As the patient with IDD and dementia progresses in their disease, then this workshop also lets people know about how you can modify the environment, perhaps change the lighting, the shadows, the music, different strategies to help adjust the individual to the dementia progression that they experience, all culminating with ways to consider and prepare for end-of-life care. So I've gone through this thoroughly because I'm wanting to entice you and your colleagues, anyone you know, to attend a nearby 2-day workshop that we will be hosting in your area. Let me tell you that in the great state of Texas, now that we're in the second year of our funding, this means that we've already been to San Antonio and Austin in our first year of funding. This current year, we have been to Amarillo, and in about 2 weeks, March 21st and 22nd, and optionally the third day on the 23rd, we'll be specifically in Arlington, Texas, so the Dallas and Fort Worth area. At the end of my slides, I'll provide more information to you on the exact location and how to register for that if you're interested. And of note, because this grant continues for a full 5 years, there's 3 more years of us visiting cities near you if we've not yet been there, and we encourage you to participate and attend. So that is our first goal, educate. Let me move on to the second goal of our grant to help aging adults with IDD, and that is to listen to the people who live with and daily care for aging adults with IDD. The first is that at the end of every workshop that we host in a different Texas city, we spend about 2 hours sitting with stakeholders in the area, whether that's the attendee of the workshop, or perhaps it's healthcare providers in the area, state administrators of the local LIDA. That's the local IDD administration that helps provide services for IDD individuals in that region. And primarily what we're asking is these 2 overarching questions. What barriers to healthcare and access do you and your clients encounter? And then secondly, what resources would help you do your job better and more quickly and more efficiently to help our Texan adults with IDD get the help and the health care that they need? I've already mentioned earlier in the talk about the political or policy environment that we see in dental care, starting with the National Council for Disability and now in the hands of the Special Care Dentistry Association to roll out curriculum and credentialing for oral health providers. We continue in the second bullet point there at the top of this slide to do state and national advocacy, most often by our colleague, Dr. David Frey, in the role of president of the Disability Division of the Special Care Dentistry Association. So we want to let you know proudly of his contributions and work, helping the National Council on Disability a year ago publish this report, which specifically talked about how can Medicaid better support oral health care coverage for this niche, adults with IDD. And as Dr. Sadowsky reminded us, the reason this is often the underserved population is they have aged out of the long care that they've received from their pediatric dentist or from their pediatrician, and now as an adult are having to find new providers in nearly every specialty of medicine and dentistry. So to that end, the third bullet point here about listening is we're hoping to hear from you and others across the state that, yes, I want to be added to the Texas provider database. And this will be a growing list of healthcare providers in Texas, not only interested in, but willing to treat and manage patients who are aging with IDD. And so this is a little clip from our collaborators' website, branchly.com, that shows an example of a few providers and how you can be added to the list, currently just kind of as an internal resource for us to know who to reach out to as a collaborator as we network across the state. Because based in Houston and familiar with the other dental schools across the state, we're more familiar with the providers in the big cities of Texas. But we know that adults with IDD live beyond the borders of those cities, and we want to know who can care for them in their locale. So let's move on to the third and final goal of our grant, and that is to connect ourselves and support all of our stakeholders and team members across the state with this common goal. One benefit of completing that third optional day of the workshop series I described that's offered by the NTG is that you automatically become a member of the NTG's Area Regional Trainer Network. This means that the NTG provides you with resources, PowerPoint slides, websites, videos, not only to help you and your organization, but to train others at your organization or at neighboring organizations in your community. This ongoing connection between the National Task Group and the trainers across the country, specifically in Texas as well, is that you'll have access to emails, Facebook account, and critically regular webinars where you can learn from national experts on how to better care for adults with IDD under your supervision. One of the things we've heard from stakeholder feedback sessions to date is that it's often the case that an adult with IDD is taken to their physician or dentist not by a family member, but rather by a direct support professional or even just a transport assistant who does not know the patient personally. So when you, the healthcare provider, begin to take an oral health history or a medical history on this patient, it's based only on the communication ability of the patient because their accompanying person does not know that history. And if this is the first time you've seen the patient, you don't have a history either in electronic health records. To help facilitate this process, we thought that we might have some tip sheets for those direct support professionals or the transportation assistants so that they can know what information would be helpful for me to gather as I escort this patient to their healthcare provider. And so too, even another category of tip sheets could be once the provider has landed on what they think could be in the differential diagnosis for this patient, then there is a variety of tip sheets that helps them know the likelihood of this condition in adults with IDD and the like. Because for the general dentist and maybe even the general cardiologist, providers who haven't specialized in developmental disabilities to date, they may not know the special nuances of healthcare for an adult with IDD. And further, they don't have the time to take lots of continuing education classes or look up things on their own in the moment, in the appointment. And so these one-page tip sheets could be filling the gap. Finally, and perhaps most excited, is Project ECHO, or our excitement about Project ECHO. Let me describe how this program works. It's a monthly webinar that we host and is attended by anyone in Texas who wants to know how can we better provide health care and accommodations for adults with IDD. Specifically, here's kind of the flow for why Project ECHO exists. Notice there on the left that people need easier access to specialty care. This could be, in our case, adults with IDD, but other Project ECHOs across the country might focus on women with breast cancer or people with atrial fibrillation and other alterations of their heartbeat. So each Project ECHO across the country focuses on a different healthcare topic. But what's common to all is that because there aren't enough specialists to treat that given condition, then Project ECHO fills the gap by having a hub of experts. It could be people who are physicians or dentists or physical therapists in not even the same city, but across the country who would join the Zoom meeting as experts of the hub. They then, through these monthly interactive sessions, are training everyone who is logged on as the listener, what we would call a spoke site. So you could be a spoke site to our ongoing Project Echo, which recruits Texas spoke sites to, in advance of the monthly meeting, submit an anonymized case of an adult with IDD that perhaps you previously or currently work with, and there was some sort of conundrum or difficulty that you'd like others to weigh in on and provide advice. It's all anonymous and there's no diagnosing or prescribing, but through talking through the scenario and getting feedback from the experts, you learn tricks and tips to apply. And we even get to hear from members who are attending from other spoke sites who might have encountered a similar scenario. It's through this that we all teach and we all learn. We're spreading and connecting knowledge so that we can support each other. So through this Project Echo, more doctors, nurses, and dentists can provide specialty care to their patients. All right, so we're coming to the third and final objective for our time together, and that is letting you know how you can connect to the work of our grant and how this could directly benefit people and groups in your community. So the first one links back to our first objective of educating, and that is to invite you to our next two-day workshop. Remember, this is a workshop led by the National Task Group, NTG, that will teach you over 2 days about intellectual and developmental disabilities and their propensity to develop dementia at an earlier age than others. This workshop that'll occur March 21st and 22nd will be in Arlington, Texas. If you at this last minute can join us, we'd love for you to by logging in and registering at that website offered at the bottom. If this date doesn't work out for you, remember that we'll be coming to other cities like Houston, Lubbock, maybe even Midland, Odessa, El Paso, etc. over the next 3 years. And you can stay connected with us. We'll provide our emails on the final slide so that you'll know when and where to join us. A second opportunity I'd like to invite you to do is to put your name in the hat to be included as a Texas provider that would go to our internal database where we can keep you abreast of future workshops, the progress of our grant, and let us know about who in your area, whether they're a dentist or some other kind of health provider that has the passion, compassion, and maybe even the expertise to care for adults who have IDD. And the third and final way that you can get involved is to join our monthly Project Echo as a spoke site. So this is a Project Echo that is for Texans and by Texans. We focus on intellectual disabilities and the onset of dementia. What medications might we prescribe? Or is this person on too many medications? And other discussions like that. This occurs each Wednesday of the month, starting at 10:30 in the morning and is over by noon. Not only do we discuss a case together, but one of the experts on the Zoom webinar gives a short 15-minute lesson. So we're learning in 2 ways each month. If you have questions, you can email our coordinator at Echo Texas or either Dr. Sadowsky or me. You will get to share our contact information at the end. And again, that registration website is here at the bottom of the slide. Now, just to inspire us and remind us why we're doing this is a quote from the U.S. Surgeon General years ago, recognizing that oral health is greatly needed for us all. And the Surgeon General said, too many people outside the oral health community are uninformed about, misinformed about, or simply not interested in oral health. And I think it's perhaps because of that these adults in Texas with IDD have had such difficulty knowing they need oral health care and finding oral health care. And so the Surgeon General goes on to encourage us to take action, to have collaborative efforts, just like we're presenting to you, to advance medical understanding and access to oral health, particularly to benefit those with the poorest oral health or the greatest risk. And Dr. Sadowsky and I would like to propose that that very much is our Texas neighbors who are aging with IDD. So I thank you for sticking with us here over the noon hour. This is just a reminder again of the two of us, Dr. Jeter and Sadowsky, and an email address at which you can reach us. We're happy to take any questions or have you share your experiences, and we'll be sure that you're still connected to this information. The more we can work together, the greater reach that we have to serve this needed population. Thank you.
Thank you.
Well, thank you, Dr. Jeter, and thank you, Dr. Sadowsky. Did you have anything that you wanted to share, Dr. Sadowsky?
I just want to connect with healthcare professionals and help educate them and promote them to advocate for this group.
Okay, wonderful. Well, we're opening it up for questions now, so you can either raise your hand or type in the chat box. I had a quick question for you. You mentioned these one-pagers, the tip sheets. Are they currently available, or have they been published already?
They have not. And so this is actually one of the activities that we as grantees will be undertaking in year 3 of the grant. So that will start later this year. Actually, the idea for these tip sheets came from some of those listening sessions that I described. I'll actually even make the point raised by one of these stakeholders is that for those in rural areas, often all of the adults with IDD flock to some of the same healthcare providers because by word of mouth, they learn that Dr. So-and-so is willing to take you as a patient. And so this actually helps us hone and target these future tip sheets to those providers. Some may be very knowledgeable and experienced. Others are compassionate and willing, but would greatly appreciate tip sheets. And so we're excited to start on that venture.
Yeah, I can see where those are really badly needed and would be very, very useful. It's a great.
If you have any ideas, we would certainly like to help for your help, and we would like to have your collaboration.
And okay. Dr. Sadowsky, I was going to maybe have you comment on Amy's mention in the chat. So it says, has the expansion of dental hygiene services that can be provided in Texas an option? This profession seems posed ready to assist, especially in our rural areas of Texas.
Well, I believe it's according to the state board, dental hygiene can be done in nursing homes and in regular homes as long as there's a dental home provider for them. So yes, I think we're ready to get to know those people that do that and to work to be interprofessional, whoever the doctor is for the patient. We would love to know that.
And to that point, there's plenty of adults with IDD that due to external stimuli are not comfortable to go to the dental office, to sit in the chair, to have the bright lights, the noises, the smells. And so through the home and community-based waiver, dental hygienists can actually be reimbursed to go to the home of these patients to do oral hygiene. That's some of the work that our colleague David Frey initiated in the state of Hawaii before he came home to the great state of Texas and is trying to advocate to see if that's an option here.
But it currently is not an option right now. Is that correct?
I believe that it is, as long as it's directed by a dentist that the hygienist works for. It's just that there's that tickler of, providing hygiene services without a dentist.
Right, and it must be under the general supervision of the dentist.
Yes,
Correct. Yes, it's a collaborative effort.
yes.
It's a collaborative effort. That's exactly. Let's see, what other questions? Anything else? Or any other comments or stories or questions they would like to ask?
I think it's just continued education of those in your community. Plenty of dental faculty, particularly those that specialize in adults with IDD and others with special needs, have shared that typically it's the nonverbal patient that will be seemingly behaving oddly, even if their family member or professional caregiver can interpret that the patient is in pain. They might actually send them to a medical provider, not realizing that the origin is a dental abscess. And so just teaching that some of the behavior that they might witness is that now this nonverbal individual is scratching at or even beating themselves on the face, trying to eliminate the pain, that these, again, all behavior is communication, can be cues that, hey, we need to go to the dentist rather than the physician.
Something that I would like to add is that we have been doing research with Baylor, and we have found out that approximately 25 to 30% of all people with IDD are referred for sedation when they really don't need it. We know that young people may act a certain way, but as the adult ages, they become more inured to certain activities and are able to withstand having a simple dental prophy, and we can accommodate them. It's medically reimbursable through a behavioralist if you have one in your area.
And I'll even expand to brag on Dr. Sadowsky and colleagues in that the study she's referring to is at the Baylor College of Medicine Transition Clinic. This is individuals with IDD who are in their 20s and older, no longer eligible to be seen by pediatricians. And the study was to work with these patients who are adults who have never been able to receive oral health care in the traditional dental setting. Either they've had general anesthesia or perhaps under restraint, and bringing them into their familiar Baylor College of Medicine medical clinic in an exam room was a mock-up of a dental chair, dental lighting, etc., and using behavioral analysis and methods over even just 1 or 2 sessions of talking through and building trust between the patient and the dentist. The patient was deemed eligible and ready to go be seen for dental care and were then referred on successfully. And so that's what Dr. Sadowsky is meaning, is that with just a little bit of patience and training, there's this whole cohort of adults with IDD that can be seen in a more streamlined setting than just sent to the OR for dental care.
And that's one of the barriers that we see, is that the patient's mother wants to call, and then when they find out that the client has IDD, they say, oh, well, we don't see those. And we know now that approximately 20 or 30% can be seen in a regular dental office. So I would encourage you to not turn them away, but to see what can be done, because it might be just like a child whenever you have to count the teeth or whenever you have to show them the mirror. It's very similar to that. So I encourage you to be a part of this promotion of care for IDD and aging.
We're passionate about this, and I hope that we've passed a little bit of that excitement on to you. There really are things we can do.
I love the passion, and I couldn't agree with you more, because I think a lot of us feel it as well. We do this because we are passionate, and it's not for the money. But we do have, I do want to just mention, TechSoc has a online webinar series, Treating Patients with IDD Learning Series. Dr. Mark Bullock did those. So a lot of that behavior modification, that training, that transitioning patients, a lot of that he covers in some of his webinars. And again, about anesthesia, you know, what they need, when they need it, or who needs, because they all don't need general anesthesia and to go to a hospital to be treated. So for a little more information, you could look at those. But I love what you've presented here today and giving us these workshops. And so what the coalition and our members can do is to get the word out there, especially in these areas. If y'all can give me a kind of a list of where you're going to be and when, we can reach out to our members and see if we can't recruit some dentists and dental hygienists to attend those. Get on your Texas provider database. Listen to your Project Echo webinars. I'm sure they're very, very informative, and really work together to see what we can do to increase access to care for these individuals.
Well, you know, now that you mention it, we are looking for help to present in Midland or Odessa. So we're looking for someone that would be willing to help us find out what kind of clients are there, where we could do it, what service providers that we could advocate to come. So
Okay.
if you know of anybody out there that has the passion, have them contact me.
Okay, I'll do it. I'll do it, Dr. Sadowsky. That's great. I'll put that up for Midland, Odessa. Do y'all have any month in mind? Or would that be this year?
It would probably be in the summer. We don't know late summer or early summer, but one of those.
Okay. Okay.
Because we're also planning one in Houston. We don't know if it's late summer or early summer, so maybe we can, you know, come get them advocated.
Okay.
Yeah, Beth, it often just depends on the logistics. We're working on the schedule of the host in the given city.
Yeah.
Oh, okay.
Yeah.
So we need a host. Well, we can talk offline. I was wondering about the facility that you would need. Are you looking for a meeting room, or do you need like a dental clinic, or what exactly are you looking for?
We're looking for a meeting room that would fit approximately. We don't like to have too large a group, so around 50 would be the max, you know.
Okay. All right. And I'll probably email with you offline and get some more information about that. Okay, that would be great.
Okay, that sounds great.
Any other questions? Anything? We've got a few more minutes if anybody would like to ask a question.
Yeah, we'll even take verbal questions. That would be fine.
Absolutely. Amy, did they address everything you wanted to in your question? I believe you did, but I wasn't sure. She might have a follow-up or anything.
Okay. Yeah. Thank you so much for having us today. It's really meant a lot to us, and to get the education part out is really valuable to us.
It is. And we thank you for what you all are doing, and thank you so much for your time today and this presentation. I do want to, and all these great opportunities to really help advance access to dental care for the aging adults with IDD. So thank you both again for this wonderful information. We'll get on the stick and try to get some information for you on these locations, and see what we can do to sign up more providers for you.
All right. Fantastic.
Thank you.
Thank you all for joining us today. Have a wonderful Friday and weekend. Stay safe and stay in touch. If you have any questions or any follow-up that you would like, I'm happy to email them for you. And then also, if you have any providers that you want to sign up, please you can send us the list, or you can contact Dr. Sadowsky or Dr. Jeter directly.
Yeah.
So thank you again, and have a nice day and weekend.
Thank you.
Thank you. And this is recorded, and so it will be provided on our website for edification and referral if anybody needs to go back and watch it, or send it to a colleague and let them watch it. Anybody that's interested in knowing anything about this, please forward the recorded link to them so that they can have this information. Thank you. Y'all have a nice weekend.